Good morning. We're here to talk about Tailor's bunion. There's a question that was requested from a person online who saw my YouTube video about the minimally invasive 5mm bunionectomy via www.scarlessbunion.com. I spoke about the bunion as the big toe joint where this goes out. We have a big bump on this side. Well, the person asked for if I have information about Tailor's bunion because they have a Tailor's bunion. So what is a Tailor's bunion? A Tailor's bunion is when you have a bunion on the opposite side, the fifth toe region on this side. And the reason why they call it a Tailor, Tailor bunion, is because when a tailor sits and does their tailoring work back in the olden days, they would sit cross-legged, and this fifth metatarsal head would be on the ground, get a little inflammation, red, etc. So they call that a Tailor's bunion. And how do you know if you have a Tailor's bunion? Well, remember, a bunion is on the big toe joint and a Tailor's bunion is on the fifth toe joint. So sometimes people would actually have a wider foot because it is Tailor's bunion on his outside. So the question is, can the minimally invasive bunionectomy procedure be used for a Tailor's bunion? And the answer is yes, indeed. Definitely can be used for that. Same procedure. It's actually easier on the fifth toe than on the first metatarsal. We're not dealing with the sesamoid apparatus, which we try to avoid during our procedure. The bone is a lot smaller on the fifth metatarsal, and frankly, the fifth metatarsal at the head heals a little bit faster than the first metatarsal. So basically, we make a 5mm or less of a cut on the side of the fifth metatarsal, stick a blade right through, make a cut right through the neck, the surgical neck of the fifth metatarsal, or sometimes a little bit further up, to shift the cartilage and the bone over to this side, versus the regular Peabody bunionectomy where we're taking the big toe, making a cut and shifting the big part over to the first metatarsal head over. So we're shifting the fifth metatarsal head over. Yes, that can be done, and I'll show a case right after this video of a pre and post. Please keep those questions coming. I like answering those questions. So visit me on www.naples.podiatrist.com. Follow me on my blogs through Blogger, and follow me and subscribe me on YouTube. Thank you. I found a radiograph of a patient that actually very recently had both a bunion and Tailor's bunion done. This will help to address a couple of things. What is a Tailor's bunion? What does it look like on an x-ray? As well as how I correct that with the minimally invasive bunionectomy. This will shed some light, and hopefully this is going to be informative as far as how a Tailor's bunionectomy and a regular Peabody bunionectomy will look right after surgery when we correct bunions on both sides of the foot. This is the before x-ray of a patient that has Tailor's bunion as well as a bunion. You notice the big bunions on both sides. This is immediately after the surgery, where you notice the two bones underneath the first metatarsal, the circles are right underneath, as well as the Tailor's bunion is fixed. And this is the post-op picture when the patient's all healed. Notice the swelling and etc. has decreased significantly. Thank you.